Hi guys, Internal Medicine NP here. I have got to share a letter with you that one of my recent patients shared with my organization. So as you're aware, there's many of us who are talking to healthcare organizations about covering anti-obesity medications. This letter that my patient actually sent to our CEO actually brought me to tears. It's not very easy to bring me to tears. We won't mention the person's name. With Diversity Week 2022 approaching, I felt inspired to write a letter regarding a topic that is near and not dear to me, but not often discussed because of the social stigma. When I think about diversity and inclusion, one of the first questions that come to mind is, can I be my true and authentic self at work? The answer I must give is no, not all the time. The American Medical Association classified obesity as a disease in 2013. Almost 10 years later, many healthcare organizations, insurance companies, and even physicians do not treat obesity as a disease, but consider it a moral issue, a personal failing, a problem with willpower and laziness, and not a result of genetics, epigenetics, societal factors, medication side effects, environment, and/or underlying diseases. There's an implicit and explicit bias of obese individuals that is often ignored and at times even encouraged. If our organization, employee and non-employee population is a cross-section of the rest of your population of adults in the United States, then approximately 1 in 3 of our caregivers is personally affected by obesity per the AMA. When I worked on site at one of our hospitals, my chair would frequently sink down and eventually broke because of my weight. A lot of task chairs have a weight restriction. The American with Disabilities Act doesn't consider obesity as a disability, so filing an ADA request for reasonable accommodation of a larger chair would have likely been denied immediately upon filing. Will that chair hold me? How many people are already on the elevator? Can I fit at this crowded conference room table in this small room? Should I sit in the chair in the back so other people aren't uncomfortable? What will the temperature of the room be? These are some questions that frequently cross my mind. I once asked during an HR town hall why our medical plan doesn't cover medications that are FDA-approved treatments for obesity, but does cover the exact same medication for other diseases like type 2 diabetes. The answer I was given was one of the benefit leaders at the time, that BJC is on par with what other organizations don't cover, plus we have discounts to Weight Watchers. As someone who has battled obesity for most of her life and attended Weight Watchers in the past, it was another in a long list of brush-offs I've received from healthcare. My first thought was, so, who cares if it's what everyone else is doing? Why can't we be the groundbreakers? I'm going to skip forward so I can finish all of it. We as an organization can make the decision to cover medications like Wegovy and other FDA-approved medications for obesity in our formulary. Instead of being leaders of change, we, like so many others, kick the can down the road. We cover treatments and medications for high blood pressure, cardiovascular disease, joint replacements, cancer, infertility, diabetes, strokes, mental health issues, and organ failures, and many more secondary diseases that are linked to obesity. These can ultimately cost just as much, if not more,